7 silent health warnings after 70. A doctor's advice to help you live longer. Have you ever woken up in the morning feeling strangely exhausted, even though you went to bed right on time the night before? Have you ever found yourself short of breath after just a few steps up the stairs? Or needing to grab onto the armrest just to stand up from a chair because you felt dizzy? And instead of looking for the real reason, you simply shook your head and thought, I guess I'm just getting old. If that sounds familiar, then I invite you to pause for just a moment, because what you're feeling might not just be aging. It might be your body quietly trying to warn you, sending subtle signals that, if ignored, could cost you the precious years still ahead. My name is Thomas. I'm 75 years old, a retired geriatric doctor who spent over 40 years walking alongside people just like you, those stepping into their 70s with a deep hope to live long, live well, but unsure where to begin. And in all those years, I noticed something over and over again. Most seniors don't pass away from a sudden stroke or an aggressive disease that strikes out of nowhere. No, many fade slowly, quietly, because of small signs that feel familiar, easy to brush off. But no one pays attention. I remember a patient, Evelyn, 72 years old, who kept waking up at exactly 3 a.m. every night. She thought it was just part of getting older. But 6 months later, she was rushed to the hospital with a sudden spike in blood pressure, and her heart had already begun to fail. If only we had listened to her body sooner, things might have turned out very differently. That's why I made this video, not to scare you, but to help you take back the power of truly listening to your body before it's too late. In the next few minutes, I'm going to share 7 warning signs I call the body's whispers. If you learn how to hear them in time, they could help you live another 5-10 years, not just longer, but better, with less pain, more freedom, more control. If you truly care about your health after 70, I believe what I'm about to share won't just be helpful. It could completely shift how you see your own body. Because living longer isn't just about how many birthdays you have left. It's about the quality of every single day. And sometimes, all it takes is noticing one small sign to prevent something far bigger from happening. If what I've said so far resonates with your own experience, then I hope you'll stay with me. And if you don't want to miss deeper, honest conversations about staying healthy after 60, feel free to hit subscribe. I'll be here to share, not to judge, and to walk this path alongside you. Now, let's look at the first sign. It seems small, but it's often the very first red flag people miss, waking up at 3 a.m. And the story I'm about to tell makes it all very clear. Sign number 1, waking up at 3 a.m. A small signal, a big consequence. Are you waking up at the exact same time every night? Maybe it's 2:50, maybe 3:07. But every time you open your eyes, stare at the ceiling, and find yourself unable to fall back asleep. You lie there in silence, no noise, no clear reason. But sleep is simply gone. If this has been happening night after night, your body is trying to tell you something. This isn't just a case of normal aging sleep patterns. In many cases, waking up at 3 a.m. consistently is an early sign of hormone imbalance or an overstimulated autonomic nervous system. Several studies, including reports from Harvard Medical School, show that while people over 70 may sleep less overall, sleep quality becomes more important than ever. If you're losing deep sleep in the second half of the night, Your body can't regenerate hormones, regulate blood pressure, or recover your heart. And the consequences may include chronic hypertension, daytime fatigue, early memory issues, or even silent heart failure. I once had a patient, Evelyn, 72 years old, whom I mentioned earlier. She came to me after waking at 3 a.m. every night for 4 straight months. At first, she thought it was just aging, but her early morning blood pressure read 168/95 mmHg. We discovered she had a cortisol regulation disorder, meaning her stress hormone was spiking at night, overactivating her heart and nervous system. She only realized something was wrong when she collapsed while walking into her bathroom one cold winter morning. So, what can you do today if this sounds familiar? First, don't go to bed hungry. A light snack before 8 p.m., like a slice of whole grain bread with warm milk, can help stabilize your blood sugar overnight. Second, avoid screens, phones, and TV at least 1 hour before bed. Blue light delays melatonin, your body's natural sleep hormone. Third, if you wake up at 3 a.m., don't toss and turn. Instead, sit up, turn on a small light, read a paper book for 15 minutes, then try lying back down. Your brain will start to associate this hour with calm rather than anxiety. If it lasts more than 2 weeks, see your doctor. Ask to check your cortisol levels, nighttime blood pressure, and evaluate for deep sleep disorders. Early treatment can prevent major consequences later on. Do you see yourself in this story? If you've been waking up in the middle of the night for several days in a row, leave a comment below so not just I but others reading alongside you can know they're not alone. And if you want to go deeper in understanding your body, after 70 hit subscribe. I'll be here not just to speak, but to listen and to walk with you through this journey. Now let's move to the next sign, a sign many people overlook because they think their heart is fine. But it may actually be one of the heart's quietest warnings. Sign number 2, mild body discomfort, but your heart is trying to speak. Have you ever walked up just a few stairs and felt a tightness in your chest? You paused, placed a hand over your heart and told yourself, it's probably just a little fatigue. I'm not young anymore. You waited a few minutes, the discomfort faded, and you carried on like nothing happened. If you've experienced that, I want you to stop and take a closer look. That dull, tight feeling in your chest during activity, especially when climbing stairs, carrying groceries, or walking briskly, is not normal for aging. It may be an early sign of ischemic heart disease where the heart muscle isn't getting enough oxygen. In simpler terms, your heart is working too hard because the arteries supplying it are narrowing and you don't even know it. According to Mayo Clinic, nearly 50% of angina cases in older adults don't show up as sharp chest pain. Instead, it might feel like heaviness, fatigue, or shortness of breath. And for older women, the signs are even easier to miss. I remember Paul, a 74-year-old former maintenance worker. Strong, lean, no smoking, no obesity. But recently he started breathing harder, just walking from his house to the car. One day, he told me he felt a tight pressure while shopping, but it went away after resting a few minutes. He assumed it was back pain and took some over-the-counter pain meds. But weeks later, while walking in the park with his grandson, he collapsed on the pathway. We found he'd been experiencing mild ischemia for months, but since there was no sharp pain, he had ignored the warnings. If this sounds like you, please don't wait. First, start logging any discomfort, what time, what activity, how long it lasted. Even if it's just 30 seconds of mild pain, it matters. Second, see a doctor for an EKG echocardiogram and possibly cardiac enzyme tests. These help detect low oxygen flow to the heart early. In the long run, consider practicing slow breathing during activity. Inhale for 4 seconds, exhale for 6. This reduces heart stress. Eating less salt, more leafy greens, and potassium-rich foods like bananas, avocados, and spinach. Asking your doctor about low-dose aspirin if you're high risk and it's recommended. The heart doesn't shout, it whispers. And if you're willing to listen, you might just prevent a heart attack down the road. Have you ever felt that light chest pressure and brushed it off? If so, leave a comment not to alarm anyone, but to let others like you see. It's time to get checked. And if you found these stories help you understand your body better, consider subscribing. I'm not here to lecture. I'm here to walk with you through each stage of aging with clarity and calm. In the next part, I'll talk about a very common sign, one that's especially dangerous if you've been losing weight without knowing why. Don't miss it. Sign number 3. Unexplained weight loss, a quiet signal. A serious risk. Have you stepped on the scale and noticed you've lost several pounds in just a few weeks, even though you haven't been dieting? Have you started folding your old clothes because they're suddenly too loose, but instead of feeling happy, you feel concerned? Unintentional weight loss is not good news after age 70. In fact, according to the World Health Organization, losing more than 5% of your body weight within 6 to 12 months without trying is considered a red flag. It could indicate serious underlying conditions such as gastrointestinal cancers, hyperthyroidism, advancing diabetes, or severe muscle mass loss. I once treated Mr. Raymond, 78 years old, a retired history teacher, 5 feet 10 inches tall, and used to weigh 180 pounds. When he came to see me, he had dropped to 164 in less than 2 months. He told me I haven't changed my diet. Maybe I'm just getting old and not absorbing food like before. But that steady weight loss, along with reduced appetite, early satiety, and diminished taste, made me recommend a gastric endoscopy and a pancreatic ultrasound. Sadly, he was diagnosed with early-stage stomach cancer. Thankfully, because we caught it in time, he was successfully treated. So if you're losing weight without trying, don't dismiss it. First, monitor yourself for 2 to 3 weeks. Are you eating less? Do you feel bloated, have mild diarrhea, or experience ongoing fatigue? Then see your doctor to run a full blood panel, CBC liver enzymes, and thyroid function tests. Consider a GI endoscopy if you've noticed taste loss, difficulty swallowing, or a consistent lack of appetite. Check your muscle mass because not all weight loss is fat loss. Losing lean muscle can be far more dangerous. If you've lost 8 to 10 pounds within 2 to 3 months without dieting, share your story. Someone reading it might realize it's time to get checked. And if you'd like to keep exploring these subtle signs with me, hit the like button and share your thoughts in the comments. There's still so much we need to talk about when it comes to staying healthy after 70. Coming up next, I'll share something that seems harmless, a dry mouth, but when it happens, often it can silently signal one of the most common undiagnosed health issues in older adults. Uncovered 04, constant dry mouth, just thirst, or a deeper warning. Do you wake up with a dry, scratchy throat? Do you keep a glass of water by your bed because you're always thirsty at night? Have you started avoiding dry foods because they feel hard to chew or taste bland? Many seniors assume dry mouth is normal. It's just age, they say, less saliva production. But if it happens, often don't ignore it. According to the American Dental Association, ADA chronic dry mouth doesn't just affect eating. It may be a warning sign of undiagnosed diabetes, salivary gland dysfunction, or a side effect of certain medications like those used for blood pressure depression or Parkinson's. One of my patients, Alice, 76, came to see me because she was struggling to eat and always needed to chew gum to stimulate saliva. After a few conversations, I found she was taking 3 different blood pressure medications, all of which reduce saliva production. On top of that, she had never taken an HbA1c test, the simple blood test that screens for prediabetes. Her result came back at 6.3%, above the threshold for prediabetes. That explained why she felt so thirsty at night, tired in the morning, and couldn't fall back asleep. So what should you do if you're experiencing dry mouth? First, review all your medications. If you're on more than 3, especially for blood pressure, osteoporosis, or depression, ask your doctor about adjusting or reducing your dosage. Second, get your HbA1c checked every 6 months. It's a quick test, but extremely important after 65. Third, use a humidifier in your bedroom and sip water in small amounts throughout the day instead of drinking large amounts at once. And if symptoms persist beyond 3 weeks, see an endocrinologist. Dry mouth isn't just an inconvenience. It can be your body's quiet way of saying something deeper is wrong. Are you going through something similar? If so, share your experience in the comments, because your story might help someone else who's silently suffering. And if what I've shared today resonates with you, pass it on to a friend or family member. There are so many signals our bodies give us that we were never taught to recognize. In the next part, I'll talk about something far more dangerous than it seems, that dizzy or unbalanced feeling when you stand up. It may seem minor until it causes a fall, a fracture, and sometimes the loss of your independence. Don't miss it. Sign number 5, dizziness. When standing up, a silent warning from your circulatory system. Have you ever stood up from a chair and had to grab the table quickly because you felt lightheaded for a few seconds? Have you stepped out of bed in the morning only to feel like the room tilted for a moment? If that's happening more than once a week, please don't brush it off. Brief dizziness when standing isn't just blood rushing to the brain or getting up too fast. It could be a sign of something more serious. Your circulatory system may no longer be adapting well to sudden changes in posture. According to research from Johns Hopkins Medicine, this condition is called orthostatic hypotension, a common issue in adults over 70, but one that's often overlooked. And here's the danger: it's a leading cause of falls. And for seniors, a fall isn't just a bruise. It can be the start of fractures, hospitalization, reduced mobility, and sometimes a slow and permanent decline. I once treated Mr. John, a 77-year-old retired mechanic. He had the habit of getting up quickly after sitting like he always had. But within 2 months, he fell twice, once in the kitchen, and the second time in the bathroom, hitting his head on the edge of the sink. Thankfully, he didn't suffer a brain injury, but that day changed everything. He began avoiding walking alone, he slept more, ate less. We checked his blood pressure. Sitting, it was 125/75. Standing, it dropped to 90/60. That drop was too large, a clear sign his heart wasn't pumping blood to his brain fast enough during position changes. So if you feel dizzy when you stand, here's what you can do. First, rise slowly and in stages. Go from lying to sitting, wait 10 to 15 seconds, then stand up. Hold on to a sturdy surface as you stand. Don't start walking immediately. Stay hydrated. Even mild dehydration can worsen blood pressure drops. If you're on a low-sodium diet, ask your doctor whether you need to adjust it. Track your blood pressure, measure it while sitting, and again while standing both morning and evening for 3 days. If the drop is 20 millimolars or more, bring that information to your doctor. Also, do light leg exercises, gentle sit-to-stand movements, ankle flexing while seated, or slow walks. Strong leg muscles help your blood vessels push blood back to your brain more effectively. Have you ever fallen just from standing up too quickly? If so, you're not alone. But don't let one fall rob you of your confidence and independence. Please share your story below or leave a message for someone else who might be going through the same thing. Next, I'll talk about a sign that seems harmless, losing interest in things you used to love. But behind that could be early depression or even the beginnings of dementia. Don't skip it. Sign number 6, losing interest in what you used to love. Did you once love gardening, reading, or taking a gentle bike ride each afternoon? But now you look at those things and feel nothing. You no longer feel like leaving the house. You don't want to call anyone, and when visitors come, you secretly hope they don't stay long. Many believe this is just normal aging, a quiet withdrawal, nothing more. But the truth is, losing interest in life is one of the earliest signs of late-life depression. And sometimes it's the first symptom of cognitive decline. According to the National Institute on Aging, depression in seniors doesn't always show up as crying or obvious sadness. Instead, it shows up as silent loss of motivation and a quiet retreat from life. Left unaddressed, it can affect memory, blood pressure, sleep, and even immune function. I remember Mrs. Helen, 79 years old, who came to my clinic with tired eyes. She used to paint every morning, but in recent months, she had put away her brushes, stopped talking to her daughter, and often sat silently for hours. After a simple mental health screening, she was diagnosed with mild depression. With the right support, some light counseling, and gentle daily movement, she slowly began to return to herself. It was slow, but it was real. So if you're starting to feel disconnected from things that once brought you joy, try this. Take a 10 to 15-minute walk outside each morning. Call one friend a day, even if it's just for 5 minutes. Write down 3 things you feel grateful for today. And most importantly, tell your doctor or a loved one that you're feeling off. You don't have to carry it alone. Have you ever felt that quiet loss of joy? If so, leave a message below, just one honest sentence. You never know, your words might help someone else recognize themselves. And if you found this content helpful, follow the channel, because caring for yourself in older age isn't just about medicine. It's about protecting your spirit too. Sign number 7. A small wound that just won't heal. Do you have a tiny scratch on your hand from bumping the edge of a table, or a small scrape while gardening, but after 2 weeks, it still hasn't healed? Or maybe you noticed a bruise on your wrist that lingers for days without fading. Slow wound healing after age 70 isn't just because your skin is getting thinner. It's often a sign that your immune system and blood circulation are weakening. According to Harvard Health, delayed tissue repair may indicate underlying conditions such as diabetes, anemia, poor vein function, or chronic inflammation. I remember Mr. Daniel, 76 years old, who lightly scraped his knee while tending to his backyard plants. It was just a small wound, but even after 3 weeks, it remained red, moist, and unhealed. We ran some tests and found that his fasting blood glucose was slightly elevated, 120 blood-ml, indicating early prediabetes. He was also low in vitamin C and zinc, both essential for tissue repair. That combination delayed healing, and if left untreated, could have led to infections or even chronic ulcers. So, if you notice your wounds are healing slower than they used to, here's what you can do. Clean the wound gently and keep it dry. Avoid using strong ointments without medical advice. Add more fresh foods rich in zinc, 10 to 15 milligrams a day, and vitamin C to your diet. Get your blood sugar checked, especially if it's been over 6 months since your last test. Monitor areas of your skin that bruise easily or swell without clear cause. Have you ever experienced something like this? Don't hesitate to share your story. Might be the nudge someone else needs to get checked in time. And if you want to keep learning how to recognize these quiet signals from your body, the ones no one ever taught us to listen for, stay with us. Because growing older doesn't mean giving up. Now, in this final part, I want to share something truly important. Every one of these signs, if caught early, can be the starting point of a healthier, more empowered journey through aging. Don't leave just yet. Final thoughts. You see, it's not random that your body wakes up at 3 a.m. every night. It's not without reason that you're winded after a few steps or suddenly losing weight, even though your eating hasn't changed. And no one ages overnight. Every change begins with small, quiet signals. The 7 signs I've shared today, from unusual sleep patterns, chest tightness, unexplained weight loss, constant dry mouth, dizziness upon standing, loss of interest in life, to slow healing wounds, are all ways your body is speaking to you. And you know what's amazing? If you listen early, it's not just about preventing illness, it's about reclaiming control of your life after 70. With better health, more independence, and a deeper peace of mind. I truly believe this aging isn't the scary part. The scary part is believing in limits that aren't real. If there's one thing I've learned after 40 years of caring for older adults, it's this: you don't need to prove anything anymore. You just need to live truthfully with yourself every single day. So now I invite you to share with me which of these 7 signs hit close to home. Or have you experienced one of them and managed to overcome it? Leave a comment. Just one sentence, because your story might be the priceless encouragement someone else needs right now. If this video resonated with you, don't forget to follow the channel, so I'll know you're still walking this journey with me. And if you'd like to support this mission, you can make a small donation through the link below, completely optional from the heart. As long as you're here, I know I'm doing something meaningful. See you in the next video, where we'll keep walking this path stronger and wiser, even after 70.